Good morning, everyone. I'm Aleinikoff, the dean here, and we are delighted to be welcoming the minister, Dr. Tedros, here this morning, and to be honoring Mark Dybull. Just a quick word about the O'Neill Institute here. The O'Neill Institute for National and Global Health started, I guess we're 3 years old now, 2.5 years, something like that. It's a collaboration of the law school and the School of Nursing and Health Studies at Georgetown. And located as we are here at the foot of Capitol Hill, we really aim to be, and we're quickly on our way to being, the leading site for interesting discussions on health law and policy, both at the national and the international level. Larry Gostin, who's director of the Institute, is away. He's been on a well-deserved sabbatical, although apparently flying back and forth working on emergency planning for the Obama administration. His work has been in the global health areas, all of you know, as has Ambassador Dybull's, and we are really delighted that Mark has joined us here at Georgetown at O'Neill. And I'll say a few words about His Excellency, Dr. Tedros. He's Minister of Health of the Federal Democratic Republic of Ethiopia, a job he took on in 2005. And he has served in a number of expert and leadership positions prior to that, both at the federal and the regional level. He's globally recognized as a malaria researcher, co-authoring numerous articles on the subject in prominent scientific publications, and here I'll just read a few, including the Annals of Tropical Medicine and Parasitology, the Lancet, Nature and Parasitology, I'm not saying that right, Parasitology, something like that. Whatever it is, it's scary. Key among his contributions was a study of malaria incidence among children living near dams in northern Ethiopia, which he authored and published in the British Medical Journal in 1999. And this contribution earned him the distinction of Young Investigator of the Year from the American Society of Tropical Medicine and Hygiene. He holds many posts. I'm just amazed at the range of activities he's involved in. He is currently the chair of the Global Fund to Fight AIDS, Tuberculosis, and Malaria, and serves as chair of Roll Back Malaria Partnership. Served as the chair there until May of this year, and he's currently the chair of the UN AIDS Program Coordination Board. He's also co-chair of the Partnership for Maternal, Newborn, and Child Health, Vice Chair of the Executive Committee of the Partners in Population and Development, and a member of the Global Alliance for Vaccines and Immunization Board. Dr. Tedros has been serving as a member of the High-Level Task Force for Innovative Financing for Health Systems, which is co-chaired by the World Bank President Bob Zellick and the UK Prime Minister Gordon Brown. It's a great CV. It's a huge contribution to the world's health, and we are delighted to have you here, Dr. Tedros, and we even have a slight token of our esteem for you. So please come forward, and we can present you with this on behalf of the O'Neill Institute. Then I'll turn the podium over to you. We welcome you here this morning.
Thank you very much. I'm glad that Mark, my brother, brought me here. Really glad through him to find many colleagues and friends here. Dean Alexander Aleinikoff, distinguished guests, friends, and colleagues, thank you for being here, and I'm very pleased to be here and to have this opportunity to recognize, along with so many friends and colleagues, the outstanding contributions of an exceptional individual, Ambassador Mark Dybull. I want to thank all at the O'Neill Institute and those involved in the organization of this event, especially to Dean Aleinikoff. Ambassador Dybull has shown exceptional leadership across Ethiopia's diverse AIDS response community, and I would venture to say that the same is true in all other PEPFAR-supported countries. I can give you at least 3 compelling examples of the lasting contributions that Ambassador Dybul has made from the experience of Ethiopia. Firstly, he has shown us that he is a true champion of the principle of country ownership. So much is said of country ownership in development discourse these days, Yet I have known so few who have upheld this critical cornerstone of successful development as consistently as Mark Dybull has, allowing countries the autonomy and space to lead in the identification and prioritization of their own specific problems and needs, and to design the appropriate programs to address them and to allocate the necessary resources needed to implement these programs as they see fit. This is what country ownership is about, and Mark Dybull understands this exceptionally well, and he recognized that the best way international partners can support the efforts of countries like Ethiopia to combat these complex and rapidly evolving diseases by focusing on the results rather than the process. And this requires an exceptional willingness and ability to listen to the people on the ground. Those charged with the task of shaping national policies, as well as the experts in the field who are at the forefront of AIDS service delivery in African countries, hard hit by this epidemic. His unwavering support of country ownership of the AIDS response has been the bedrock of PEPFAR's dramatic success in Ethiopia. Secondly, Ambassador Dybull has also shown a deep appreciation of the fundamental challenges that countries such as ours face in scaling up effective AIDS prevention, treatment and care services. He understands exceptionally well that we cannot hope to defeat this disease without significant concomitant efforts focused on strengthening our health systems. This includes building our human resources capacities, improving our health infrastructure as a whole, as well as our management, information and logistics and documentation capacities. And in this regard, we have seen how Mark Dybull is a man of pragmatic action, one who wastes no time in getting things done, mobilizing the resources available in order to solve the problems and constraints identified. Thirdly, Mark Dybull has also been instrumental in the significant advances Ethiopia has made in furthering the global health aid harmonization agenda. Again, with his remarkably quick and incisive understanding of the challenges we're facing in Ethiopia, as well as his steadfast focus on results, he was able to lead the way in quickly responding to the pressing need to improve coordination between PEPFAR-supported initiatives and efforts supported by other partners, particularly the Global Fund. This has been no small feat given the significant differences between the way PEPFAR and the Global Fund were designed to operate. As a result, PEPFAR's impact in Ethiopia has simply been tremendous. Today, for example, more than 155,000 Ethiopians living with HIV/AIDS who are eligible for treatment are now receiving antiretroviral treatment, compared to a mere 900 just 3 years ago. This has been in large part due to the concerted efforts of PEPFAR and Global Fund supported programs. It's the type of strong and sustained support well tailored to our specific needs that we have been receiving from PEPFAR under Ambassador Dybull's leadership that has bolstered my belief that despite the challenges Ethiopia faces, we now stand out not only to reverse the terrible toll of this disease, but also to bring about a lasting transformation in the health of our people. Given the genuine concern and his exceptional dedication to the fight against this scourge, Mark will continue to make an invaluable contribution to global health in whatever endeavor he chooses to pursue next. I know he is already doing so. Finally, as regards to Mark's personal qualities, words simply fail. Let me just say that he is one of the most gifted, hardworking, principled, compassionate, and committed people I have had the privilege to know. An outstanding leader and a truly exceptional human being. I believe he is a great pride to his country, and his exceptional leadership deserves due recognition. Mark has been a great inspiration and tremendous source of encouragement for me personally. I learned a lot from him. I feel proud to count him as a good friend, a true friend of my country, Ethiopia. Please join me in a warm round of applause for Ambassador Mark Dybull, my dearest brother, with greatest respect and appreciation.
Well, thank you so much, Your Excellency, the Honorable Minister of Health, who I also am privileged to call my brother. Thank you, Dean Aleinikoff, for hosting us here today, and to all the members of the O'Neill Institute. When President Bush was last in Africa, he said something that will stick with me probably the rest of my life. He said, Africa's greatest resource is not its oil, it is not its gold or other minerals, it is its people, the talent and beauty of its people. And I think Tedros, Minister Tedros, represents that better than almost anyone I've ever met. The minister has revolutionized not only health in his own country, but health globally. The dean listed his many activities. I don't know how he sleeps. He also has small children contributing to the problem of work and sleep. But when you go to Ethiopia, you see what it means to support leadership, what it means to support people on the ground, people who will change the world if we give them a chance. And that's what country ownership is about. It is not about us, it is about them and supporting them. And it's easy to do with ministers and leaders like Minister Tedros. You know, recently there was a book that got a lot of play because of a catchy slogan, Dead Aid. It talked about how development shouldn't happen anymore, we should stop it all. It talked about corrupt leaders and people stealing money from their people. This notion is 20 years old. There's a whole new generation of people and leaders, not at the governmental level, in the non-governmental sector, and on the ground. In the end, we all succeed, and Tedros succeeds because of his people, because of the incredible talent, compassion, and dedication to service of people. When you go to very remote places throughout Ethiopia or throughout anywhere in Africa, people who we consider to have nothing give everything they have in service to their community, in service to their brothers and sisters. It's a tremendous learning experience to go there. We have this horrible notion in development that we are coming to help poor, uneducated people. Nothing could be further from the truth. We go to support extraordinary human beings and learn a great deal in return. Many of the things that Tedros is doing in Ethiopia, the dean was just joking, we could do in this country, or should do in this country, to enhance our own health care. The advances that the minister is making in rural health care and high-quality care, in medical record systems, in integrated approaches, in prevention, in access to services. We could learn an awful lot and should learn an awful lot from here. So I hope going forward, not only have we gotten over the notion that we're coming to help poor and educated people, that was step number one. Step number two is for us to understand we should be learning a great deal from this relationship and have a great deal to learn from this relationship. And so it's moving past this awful decades of donors and recipients, and I was just at the General Assembly and people are still using those horrible words, and moving past words like aid and assistance to what the partnership really is, a partnership between equals. In fact, if anything, we are the junior partner to support and to learn from and to become deeper friends with people of other countries. And I just end there because I think this is one of the most remarkable pieces of development. Not only can we learn from people, but the relationships we can develop as human beings, the notion of an interconnected globe where we are all brothers and sisters. This is something development brings to us as well. It brings us a new understanding of people in distant countries, brings them a new understanding of who we are as people, as individuals and as a nation. And those links are extraordinary. And that development will lead to not only progress in health, but it will lead to human development, where we are growing together as a world population. And the most dear relationship I have developed over the past 7 years is with His Excellency the Minister, not only because of the work he's done in health, but because of who he is as a person. I've never met a more selfless person than Minister Tedros, and it is a deep, deep honor and privilege to be able to call him a friend and brother. Thank you all for coming. Thank you, Your Excellency. Thank you to the people of Ethiopia for showing the world how effective health, how effective development can be done, and teaching us how much people have to offer each other. So thank you very much.
Well, thank you all. Thank you, Dean. Thank you, Honorable Minister. Thank you, Ambassador Dybul. Now we have a small reception hosted by the O'Neill Institute. It's just outside the source, so if you please join us. Thank you all.